Hello everyone. So in this video I'm going to discuss about osteology of first rib. So here in my hand you can see this is first rib. This is our typical rib. You all know that there are 12 pairs of ribs in our body which forms the thoracic cage along with the 12 thoracic vertebrae and the sternum anteriorly. Okay. Now the third to ninth rib is typical. First, second, and 10th, 11th, and 12th are typical. So today I'm going to discuss the features and attachments of this first rib. First of all, let us try to understand how to identify that this is first rib. For identification, you should know some points like this first rib is the shortest, it is broadest, and most curved rib. Okay, and the shaft of this rib does not show any twisting. There is no twisting in the shaft, and the costal groove is not present in the first rib. Okay, and it is flattened from above downwards. Okay, it is flattened from above downwards. So these are the points which you should keep in mind too for the identification of the first rib. Now coming to the side determination, because you all know that there are 12 pairs of ribs. This rib may be of right side or left side. So how to determine this? For this you should know that this rib, the first rib, has an anterior end, a posterior end, and the shaft. Okay, so the anterior end is broader and it has a single facet, concave facet, which will articulate with the first costal cartilage, and the posterior end is rounded. It has head and then neck and a tubercle. So the anterior end is larger, thicker, and it is pitted, and the posterior end is small. Okay, the outer border is convex, the inner border is concave. The upper surface of the shaft is a little bit rough because it has two grooves on the upper surface, and on the lower surface, the upper surface is rough and the lower surface is smooth. So this rib which I am holding in my hand is the first rib of right side. Okay. Now this was about the side determination. Now let's discuss about the features of the first rib. Let's discuss about the anterior end first. The anterior end is larger than the posterior end. It is thicker and broader, and it is continuous with the first costal cartilage. It will articulate here with the first costal cartilage. Okay. The posterior end comprises of the head, the neck, and a tubercle. The head is small and rounded. It articulates with the body of the costal facet of the body of which is present on the body of the first thoracic vertebra. Then the neck is rounded and directed laterally upwards and backwards. Laterally upwards and backwards. Okay. Then the tubercle is large. It coincides with the angle of the rib. This tubercle articulates with the transverse process of the first thoracic vertebra. Okay, first thoracic vertebra. So the joint will be formed between this tubercle and the transverse process of the first thoracic vertebra is known as costo-transverse joint. Costo-transverse joint, and the joint which is formed between the head and the costal facet of the first thoracic vertebra is known as costo-vertebral joint. Okay, now coming to we have discussed about the anterior end, we have discussed about the posterior end. Now coming to the shaft. The shaft has two surfaces, the upper surface and a lower surface. The upper surface is rough. It has two grooves which is separated by a faint ridge This faint ridge here on the inner border forms a tubercle which is known as scalene tubercle. Okay, scalene tubercle. Now the lower surface is smooth and it has no costal groove, because in all other ribs we have the costal grooves on the inner surface, on the inner surface, but here there is no costal groove. Okay, now it has two borders, the outer border and the inner border. The outer border is convex and the inner border is concave. Now let's discuss. So this was about the features, the anterior end, the posterior end and a shaft. The anterior end is thick, wider, broader, and it has a facet, concave facet, which will articulate with the first costal cartilage. The posterior end has a head, neck and a tubercle. And the shaft has two surfaces, the upper surface, the lower surface, and two borders, the outer border, the inner border. The upper surface is rough, the lower surface is smooth. Okay. Now coming to the attachments and relations of the first rib. First of all, let's discuss about the relations of the neck. The neck is related anteriorly from medial to lateral. It is related to sympathetic chain, posterior intercostal vein, superior intercostal artery and the first thoracic nerve. So the mnemonic for this is chain pulling a van. Sympathetic chain, then we have posterior intercostal vein, then we have superior intercostal artery, then we have the first thoracic nerve. And this neck is superiorly, it is related to the 8th cervical nerve and the deep cervical vessels. The deep cervical vessels. Okay. Now this was about the relations of the neck. It is very important. Okay. Now coming to the superior surface of the shaft of the first rib. The groove, there are two grooves present on the superior surface of the shaft of the first rib, which is separated by a faint ridge. Okay, so the groove which is present anteriorly, the anterior groove lodges the subclavian vein and the posterior groove lodges in the posterior groove we have the subclavian artery and the lower trunk of the brachial plexus. Okay, now the structure which are attached on the upper surface, other structure, this was about the structure which is present in the groove. In the anterior groove we have the subclavian vein, in the posterior groove we have subclavian artery along with the lower trunk of the brachial plexus. Now coming to some attachments on the superior surface. Here anteriorly we have the attachment of subclavius muscle, and then we have the attachment of subclavius, and then the costoclavicular ligament is attached here. Okay, then the scalenus medius muscle is attached over here somewhere posterior to the groove, posterior groove. Here scalenus medius muscle is attached. Okay, the insertion of the scalenus medius muscle. Now coming to the lower surface. The lower surface of the shaft is smooth. It is covered by costal pleura and it is related near its outer border to a small first intercostal nerve. Okay, on its outer border it is related to first intercostal nerve. Okay, now the outer border gives origin to external intercostal muscle and the upper part of the first digitation of serratus anterior. The muscle serratus anterior has 8 digitation. So the upper part of the first digitation of serratus anterior is attached on the outer border of the first rib. Okay, then now the inner border gives attachment to the suprapleural membrane, which is also known as Simpson's fascia. Suprapleural membrane, which is also known as Simpson's fascia, and the tubercle which is present on the inner border, which is known as scalene tubercle, gives attachment to scalenus anterior muscle. Okay, scalenus anterior muscle, and the tubercle also gives attachment to a ligament which is known as lateral costotransverse ligament. Lateral costotransverse ligament. So this was about um, the features, the site determination, and the attachments and relations of the first rib. Thank you.